If you're experiencing lower back pain, neck pain, aches and pains, or injuries from a car accident, you need to see a licensed chiropractor. Don't suffer any longer dealing with pain. Our experienced chiropractic team can help you start feeling better in just a few visits. The best part is, treatment involves no drugs and no surgery. We're committed to bringing you better health and a better way of life by teaching and practicing the true principles of chiropractic wellness care. So contact us now to set up a free consultation. You've got nothing to lose but pain.
Okay, so can you please tell me what was the initial reason why you came here? What was the problem?
My lower back was hurting and it was really tight, and I assumed that it was from picking up my son.
Mm-hmm.
So it was just mostly pain in my kind of mid lower back.
Okay, and you gave birth what about 11 months ago?
Yeah, I had a C-section about 11 months ago.
Okay, and have the symptoms gotten progressively worse, or the pain was on and off?
For my back,
Yeah.
the pain was on and off, and it was all through my back. It kind of started up here, and then it went towards the middle, and then it just ended towards the bottom, middle,
Okay.
lower
And
back.
and did you try any other care prior coming here, or
No, just home care, as in like hot patches and
any relief, or
there was a little relief, yeah.
Okay,
but
but
I'm not a fan of anything really. Like I don't like going to the doctors or anything like that. So
Okay.
that was a struggle.
Okay, and then so this is your second session here, right?
Mhm.
So after, what's the percentage of improvement do you feel like you have after just one session that you came here?
I think based on my pain, 50%. Like when I came here, I'd already had the pain for about 4 days.
Mm-hmm.
So it was progressively getting worse, but then it started to get a little better. Like the pain was less tight.
Mm-hmm.
So I think now the pain is still there, but it's not as tight as it was. So
Okay.
I feel like whatever you did, it kind of loosened it up.
Okay,
Yeah.
that's good. That's good. Okay, so let's see where you at in terms of your lumbar range of motion. And then we'll just go from there. Okay, just relax. Okay, so that's much improved. It's a little tweak, but not much. Okay, bend forward, please. Okay. Okay, good. Stand up, please. Please, Leandro. March in place. Okay, stop. Okay, yes. Okay, go ahead, have a seat, please. Okay, lean back. Okay, lie on your stomach, face down, please. And put your hands down towards the floor. Yeah, there we go. Take a deep breath in. Out. Okay, breath in. Out. Okay, breath in. Out. Okay, good job. Go on your side, please. Face me, like you sleep on this side. Okay. So now I'm going to adjust your sacroiliac joint. Okay. Give me a hand. Put your head towards the wall. Okay. Just like this. Okay. Just relax your shoulder. Okay. Good. Okay. Now I'm going to adjust your lumbar spine. Okay. And then. Okay. Okay. You can just leave your key right here. Give me a hand. Okay, just relax. Relax your shoulder. Okay, good job. Okay. Stand on your feet. Does it feel a little bit more loose?
It does.
It does?
Yeah,
Okay.
it's all like in here. It just feels looser, so
Good,
the
good.
pain isn't as.
Well, let's
Okay.
Gail finish it off by resetting your muscles. And some
Okay.
deep tissue work, and then we'll
That
go
was
from
rough. I don't like Gail.
there. Well, but you know that's really important.
Okay.
I mean, wouldn't do like all those gentle massages here. You
Yeah.
can go to a special massage therapy place and get that done over there. But here we actually do.
Yeah. Well, that's
You-
what she mentioned,
you
you know,
know,
so she's
It
getting
needs
in
to
the
be
tissue.
it needs to be done and reset so you get better results.
Okay.
That's why combination of everything together, chiropractic and deep tissue and PT together. So
Okay.
okay.
Sounds good.